appetite, sleep, stool, urine, and how you're feeling that day. That means a change in your mood regulators.
Yeah.
Tells you the beginning of a disease.
More about what are these happiness drops. First of all, the name itself is so amazing, happiness drop.
Her complaint of OCD was so severe, Neha, she would take bath 40 times a day. That's when I started learning about Bach flower apart from homeopathy. Why this early perimenopause and all that, That's because of our lifestyle changes. Fourth one, which also works, is the tapping system, which I call. So tap on the different sinus points, which will open up your lymphatic system. Onion juice on your scalp, it has ruined people's scalp. And then they come running to us, doctor, my hair is falling, like even if I touch my hair, 15 strands come in my hand.
Hi everyone, welcome to another new episode of That Healing Feeling with me, Neha Ranglani. And my guest for today is Dr. Yatri Thacker, who is a pioneer in holistic homeopathy, mental health, and the founder and director of Baby and Me programs. With over 2 decades of experience, she has transformed countless lives through her mind and body healing approach. She has also been felicitated by the prestigious Dadasaheb Phalke Award and is a leading voice in psychosomatic healing, corporate wellness, and compassionate care. So join me in welcoming Dr. Yatri. Welcome, Yatri, on my podcast, and I'm so glad to have you here. It's wonderful to have friends come over who are experts in their own space and share their knowledge and wisdom with the audience because, like we say, healing is not one directional and it's not linear. There are so many paths to healing and there are so many dimensions to healing. So I love to bring in people from different areas of expertise and, healing modalities that people can then learn and understand how to incorporate it. So thank you so much for coming here and willing to share about homeopathy with us.
Thank you so much, Neha, for having me over. It's a total pleasure to be here, especially when two like-minded people, with the main focus of patient education, patient benefit come together. What's the best way? But this is the best way to share our knowledge and expertise. Thank you again.
That's lovely. So Yatri, tell me, you're a homeopathic doctor, homeopathy expert. Now, homeopathy is always seen as a pseudoscience. It's seen as not the mainstream or the first line of treatment for any health issue. People always go to homeopathy if other things are not working or they want something that's more subtle on their body and not too strong or doesn't have any dramatic effects. But how would you define homeopathy in this modern day and age for people to understand how it works in our body and what is the deeper meaning of homeopathy in our life?
Yeah. So, now homeopathy has been accepted by Ayush also as a mainstream, treatment. So for years, conventional treatment or allopathy treatment was called the mainstream.
Yeah.
But now we all have understood the impact of integrative system, where each system is required to handhold each other, again for patient benefit. Let me explain what exactly homeopathy stands for. So homeopathy is a very distinct integrative medical system and it's actually rooted with 3 major things. So one is the empirical data, the second is the clinical observations, and third is the vitalistic framework of the body and disease. So what does that mean?
Yeah, what does that mean?
So the clinical observation, obviously, with over the years together, whatever the clinical observation of each patient was, a data was taken. That also becomes like an empirical data.
Yeah.
And followed by vitalistic framework. So homeopathy, actually, the main core principle of it is actually deep-rooted in one main thing. That is called vital force.
Okay.
So it is understood in homeopathy that a body's self-regulatory system, when that is disharmonized, that's so dynamic, the self-regulatory system, when that is disorganized, that's when the disease is produced. So the main core philosophy or a homeopath's main aim is to bring the vital force gently,
Okay.
right in harmony.
Okay.
Now this happens through medication. And that is and it also follows the 4 basic principles. Okay, one is the individualized treatment.
Okay.
That means 2 patients of the same age suffering from same disease, yet their symptoms are different, therefore the same medicine is not given. That's the individualized treatment.
Okay.
So a homeopath's experience, clinical knowledge is of utmost importance because their case history, it is full of detailed mental, emotional, physical details, but apart from that also trying to find the mind-body connection.
Okay.
And when an experienced homeopath finds the right individualized remedy, that's when the cure really happens. That's when the vital force comes into harmony. So that's the first principle.
Okay.
The second is, it is called like, cure, likes.
Okay.
That means the homeopathy medication are actually based on this principle. For example, if you cut an onion, your eye starts watering and burning.
Right.
Onion in scientific terminologies is called Allium cepa. There is a medicine in homeopathy called Allium cepa made from onion.
Okay.
So when a patient, say, for example, comes to me for allergies of the eyes are burning or watering, or they have fever symptoms exactly of that, and when I give Allium cepa in a certain dose, the
It
disease
heals.
is gone.
Wow.
So the like, cure, likes.
Oh.
That's the second principle. The third is the holistic approach. So just one part of the body is not treated. For example, I gave you eye allergy. So we just don't treat the eye allergy, but you as an individual, as a holistic approach.
Right.
So that's the third.
Right.
And fourth is, of course, about the vital force, which is very, very essential.
So how do you work on the vital force?
So at least in my practice, I give very, a lot of importance to it. For example, 5 things: appetite, sleep, stool, urine, and how you're feeling that day. That means a change in your mood regulators.
Yeah.
Tells you the beginning of a disease.
Right.
Right? So when I give homeopathy remedy, my only way to find out once they start the remedy within 3 to 4 weeks is my question to them is, oh, how are you feeling overall?
Yeah.
How is your sleep?
Yeah.
How is your appetite? What about your motions? What about the urine? When that is better, that means the body's automatically regulatory system comes
Yeah.
is trying to come into harmony.
Yeah.
You know the disease is going, you know the remedy is right, you know homeopathy is working.
Oh, all right. Yeah, the same way like how we do it with our clients and patients. You
Yes.
give them a diet and then you give them a lifestyle change. And,
Yeah.
on the follow-up, you always ask them, how are these certain parameters and how are you feeling? How
Yes.
are your symptoms at the moment? And if anything has worked towards the right direction,
Yes.
you know that your plan is working.
Yes.
Yeah.
Yes. You know
So
you
pretty
are
much like that.
Yes, absolutely. But in that sense, homeopathy is much more deeper because the remedies that are made actually they're made through a dilution process.
Okay.
And something called as succussion, or that means we need to shake the remedy up multiple times because the nanoparticles actually absorb the main personality of the remedy.
Okay.
In very layman's language, if I say,
Yes.
we during COVID times we used a vaccine as a prevention. What was that vaccine made of?
It was the same virus.
Exactly.
That
Homeopathy works on similar principles. Same thing of the main substance in the most minutest part is taken and a remedy is made out of it.
Okay.
So it's more like a prevention. It is more also can help. So therefore, when a patient takes homeopathy and the right remedy, you will not only see the change in mental, physical, and your disease, but the overall well-being just comes in.
Okay.
So it's very deep rooted in that sense.
So it's not as superficial or as symptom specific like your allopathy.
Correct.
Okay.
Correct. Absolutely correct. So conventional medicine or allopathy, they usually focus just not on an individual, but on the disease.
Yeah, on the symptom, whatever the person is feeling. If you have a headache, take
Yes.
a crocin or
Correct.
Disprin. Or you have a stomach pain, take a antispasm thing for the stomach or whatever. So,
Yes.
Yeah.
Correct. Absolutely correct. So, yeah, that's how homeopathy works and its philosophy and science. In fact, it's been discovered in late 18th century by Dr. Samuel Hahnemann, who was an allopath.
Oh.
And he was against the system, allopathy system in those days were about just cutting the limbs if the limb had little infection. He was, it is a very
Wow.
beautiful history towards it, and how he thought that there is something more to it, how he had fever for days, then he came across something called a cinchona bark. So if he was sitting under a tree, the bark of that tree he made some medicine, and that replicated the fever symptoms of malaria, and that's the first remedy he made. And therefore I said homeopathy is about even the clinical observation and the empirical data, the data that is collected over years from a healthy individual when they take this remedy and then given right now to diseased people. So it is so deep rooted.
Understood.
Therefore I want to also mention one more thing. It's been discovered 200 years back, and whatever the remedy is discovered, that is still being used.
Right.
Whereas in allopathy, there are different generations of antibiotic, if you know a little bit about allopathy, because your body's own immune system becomes just susceptible and prone, and it won't work anymore. Whereas homeopathy remedies discovered 200 years back
and still works.
Are still working.
Yeah, because we get resistant to the allopathic treatments that we do after a point. After a point, the same painkiller, the same dosage doesn't work for you.
Right.
Or the same, antibiotic doesn't work because your gut microbiome gets resistant to it.
Yes.
But this is amazing to know that...
Yes, and therefore without any suppression, because every time you step up taking more and more allopathy doses, more suppression happens, more side effect happens.
Yeah, you land up with 10 other diseases.
Yes.
You're trying to band-aid one symptom.
Yes.
And then you're landing up with 10 other diseases. Like, okay, allopathy must be great for acute conditions where it's life-saving and you have to just get someone out of a certain situation to, give them life again. But I think for lifestyle diseases and everything that we are taking allopathy right now, I think it's more damaging and life-threatening.
Right. And thankfully, I think there is a lot of awareness now.
Yes.
And patients, in fact, prefer homeopathy over allopathy for chronic diseases, for children. So thankfully, that's really helping.
That's so good.
But I'm sure more and more awareness needs to be created over it. You know, one more thing I definitely want to mention, and over like 21 years of my practice, again, there's nothing about allopathy is bad or homeopathy is great or Ayurveda is good or Unani is not bad. I feel every system, every pathy has its own strengths and weaknesses. And as a physician, when you neutrally understand that deeply, you can give the right guidance to your patients. Like, for example, if a patient comes to me with an appendicitis, and once I've diagnosed, right? Firstly, I think also the importance of diagnosis. If a patient comes and says, Doc, I've got abdominal pain. Now, whether that pain is coming from the hypochondrium, epigastrium, which side, and then which organ is involved is essential. So once you diagnose the patient aptly, and like for example, appendicitis, then, you would know, okay, the surgery is required out there. And I would say, hey, you can come pre and post operation to me to take homeopathy, but at this stage, you definitely need a surgery. So when a physician understands the strengths and weaknesses of a pathy, that's when you can truly guide and treat your patients.
And you can integrate other systems and help the person heal rather than just band-aid the symptom, right? So that's powerful, because everything has its own place, like you rightly said. And I also read in your bio that you are a psychosomatic homeopath. How does that work? Like you deal with people's psychosomatic issues, depression, anxiety, mental health issues?
Yes,
So how
I
does
do.
that work?
So psycho means mind, somatic means body. Your body starts speaking when your mind has some kind of issues. Yes, or vice versa. You might have a lot of physical symptoms, and then your mind starts giving a different kind of picture of you, right? So, again, homeopathy is actually based on it. But over my journey, being a very curious person, right from beginning, I would always want to know, understand a person's mind. Why are they behaving this way at this disease? This person was not this way when he was healthy.
Yeah.
So what's off?
Yeah.
And what is the real connection? So I started, really getting into it. I did my post-graduation psychology after homeopathy. And slowly, I understood the power of psychosomatic diseases connected to homeopathy.
Right.
And allopathy didn't have treatment, like migraine headaches,
Yeah.
like skin diseases like psoriasis,
Yeah.
eczema,
Yeah.
urticaria, allergies. A lot of allergies are connected to your mind. Some kind of backaches with, which goes into muscle spasm without any diagnostic problems. Gut issues, you know
Yeah.
that, right?
Yeah.
Your
Yeah.
gut is your second brain, and
Yeah,
minute.
totally.
So many patients will say, I'm anxious, and then they use the loo, they have IBS.
Yeah.
Yeah?
Yeah.
So all
Leaky
these,
gut, all of that.
yes, they're directly connected to your mind, and when you're highly stressed. So, and it causes disease. So my whole curiosity was based on not only just treating the disease, but curing them. So that's how I started, then slowly integrating whatever I could to do that.
Nice. And do you have any case study which you can share with us that shows how somebody got healed with their psychosomatic issues through homeopathy?
Yeah, multiple. Actually, my practice is really based on that,
Right.
truly based on that. Multiple, but offhand, about 2 cases just come to my mind. So, the first case I would like to talk about, this lady who had severe OCD.
Okay.
And she connected to me, say, about 10 to 15 years back. And she had recently shifted from London to Gujarat. We did an online consultation. And, her complaint of OCD was so severe, Neha, she would take bath 40 times a day. I'm not
40
kidding.
times?
Like literally her skin had started peeling.
Oh my God.
She came from UK and, wouldn't allow. She reached a stage where she, even if her daughter would touch anywhere, she would ask her to take a bath at 7-8 times a day. She had thrown all the servants of the house because she'd gone into that, that phase. And then someone must have recommended my name and she connected with me. Now I'll tell you that to begin with, the first or the second consultation, I couldn't break the ice much, except
Yeah.
from her symptoms. But the third consultation, I was like, there's something there.
Yeah.
She happened to open up that she came from UK to India as giving a last chance to her husband who had cheated on her.
Oh.
And then I found out for her, cheating is washing.
It's dirty. It's like, yeah.
And when I connected the remedy, there's a remedy in homeopathy where delusion, you are dirty, you're not enough, you're being cheated. And that creates a lot of sadness, creating to some automatic response like OCD.
Yeah.
When I gave her the remedy, you won't believe what happened to her.
What happened? I want to know.
It was magical. It was magical. Within 3 weeks of starting that remedy, firstly, she got guts to divorce her husband. All right? Second, she moved to UK. She took a best decision of her life.
Okay.
She moved to UK and her bathing OCD just came twice in a
So
day.
that's okay. That's normal. We all bathe twice a day. So
From 40
Yeah.
to 2 is magical.
yeah.
And most importantly, a lady who was so suppressed, who didn't have guts to tell her husband, listen, you're cheating on me.
Yeah.
And it was not like 1, 2 cheats. She gave
Yeah.
him ample of chances, at least 15,
Yeah.
20 times.
Yeah.
And then giving one more chance and coming to India. Imagine what she must have gone through.
Yeah.
And she never connected that dirt was actually that cheat which I'm trying to wash off.
Yeah,
And when
yeah.
I made her aware with psychotherapy, homeopathy, brilliant magic happened.
My God, that's so powerful.
Yeah,
Wow.
so that is one of my best case. The second case that comes to my mind is this 16-year-old girl suffering from anxiety.
Okay.
Okay, and severe anxiety before exams. Obviously,
Okay.
the peer pressure,
Yeah.
we know all of
It's
that.
natural. Yeah.
Now comes how homeopathy is different. So she actually began with allopathy. She was given some of anti-anxiety drugs, and she would take those drugs, feel numb, feel nice, but not. The main issue was not treated. So that's how a mother connected with me.
Right.
Now, during the case history, we came across one episode when she was in 8th grade, how her teacher, for one small thing, had pointed out and, shouted on her, and she felt so bad about it that she became so nervous that she carried on that. So I took into consideration extreme sensitiveness, made her aware that 8th grade was one such episode, which is creating multiple episodes. Number 3, she was one such person who was also impulsive.
Okay.
And craving for sweets was very high. So there is this remedy called argentum nitricum.
Okay.
And which exactly, if you read the picture, is the same. Also, she had perspiration just her palms and soles.
Yeah, a lot of people have that.
And if you read that remedy, it matches exactly. Nervousness before examination, extreme sensitivity, impulsive.
Right.
And when I gave her that, she was not only confident. Now, this took about 3 months, obviously. But in 3 months, this girl started scoring well, high concentration, anxiety, panic attacks gone. And I can't tell you the amount of patients her mother referred to me later. But the main thing is this magical change.
Wow.
That you see in patients. That also keeps me going.
Of course. I think these are the success stories and testimonials that keep you going. And for all of us who are doing this kind of work of transforming people and helping people heal, I think it's just the results that motivate us to get up each day and do what we're doing. So
absolutely.
That's so amazing. Loved the stories you shared because these are so empowering.
Yeah.
I've also heard about your happiness drops, and you also gifted them to me sometime, and I had them, and of course I felt good. But I want to understand, more about what are these happiness drops. First of all, the name itself is so amazing, happiness drops. Like when you take it, I think just placebo effect is going to be okay. I'm going to feel happy after taking this. But what is the science behind it? What are these drops? Who are these for actually?
So great question. So happiness drops. Again, it was a part of my journey.
Yeah.
As my name says, Yatri. I think my life is like a journey, and I just keep on.
We
going
all are
on.
Yatris, but you are the Yatri in the physical. Your name is also Yatri.
Yeah. So during COVID times, again, we all had a shift in our practice.
Yeah.
Coming online was not easy. I had a internal rift because, from in-person consultation going 100% online was, I don't know what's going to happen.
And we didn't know what online was at that point, right? Like the whole Zoom thing was such a new format for us also to adapt to. And then all your systems, your paperwork, your files, everything was... very chaotic because you didn't know how to then completely shift to the new system.
Yeah. So that's the time I remember how COVID had hit its peak and I couldn't see patients in person, and out of panic I drove till my clinic and opened the trunk. I have like 2,000-3,000 remedies, just put everything by myself, shut the clinic. I was like, and put a board like, will not see any COVID patient because I didn't want COVID to transfer. Drove back home, emptied one whole cupboard, put all my remedies, and I would dispense myself. I would case history, everything by myself. That's the time a lot of creative transformation happened to me because I felt for the first time I was stable in one place. I had enough time to think rather than running from clinic to home and all that. And I just somehow, 5 products is what I brought online. One of them is Happiness Drops. Happiness Drops is actually a combination of Bach flower remedy. And as I mentioned, over the time with my practice, when I would, find a missing element or that jigsaw puzzle of a patient's cure that I wanted to see would not fit in, I would say, okay, I need to change something. I need to learn something. I need to fit in. That's when I started learning about Bach flower apart from homeopathy.
Oh, okay.
So they are flower remedies.
Yes.
Each flower signifies a certain kind of emotion of a person. It's a brilliant way of medicine because it complements homeopathy very well.
Okay.
So with homeopathy, one can take Bach flower, even without, but it works very, very well as a combo.
In combination.
Yes.
Okay.
And it works more so on the emotional ups and downs, emotional turmoils, sleep, a lot to do with your mind.
Right.
And then I had to name it. I said, what do I name it? And happiness just came up. And I
Yeah,
was
it's
like,
such
oh.
a it's such a no-brainer. You
Yeah.
feel happy after taking it, just name it happiness.
Yeah, yeah.
It's simple to understand. Why complicate a simple thing?
Yeah, yeah.
Yeah.
And it doesn't have side effects. Like I can give it to a newborn also. I've given that.
Wow.
Yeah.
But have you seen anyone transform their emotions after happiness drops, like instantly, or maybe the anger issues or sadness or something that's completely calmed down or washed away after the happiness drops?
Yeah, so, per se, it will not give a very deep rooted effect, but definitely the superficial. Because, again, superficial in the sense, say there is a death in the family, and that's sudden that you can't come to terms and you're crying a lot.
Yeah, you're in shock and
you're in shock, you don't
disbelief.
sleep well. That's the phase. You take Bach flower, works. For children who don't sleep well,
Yeah.
just works without homeopathy, without consultation.
Oh, lovely.
But something like anger, aggression for months together. So,
Yeah.
or there is depression, anxiety, deep-rooted
Deep-rooted
disease,
emotional baggage, yeah.
then it needs to be taken with a combination of
Okay,
homeopathy
homeopathy.
and psycho. But
Okay.
per se, you can take Bach flower, say just for a short period, you feel, oh, you can't concentrate, exams are coming. Take happiness drops, or you feel, okay, I've overworked this week. Next, I know I'm highly stressed. I know my seminars, webinars are lined up. Well,
Yeah.
let me take Bach flower and take happiness drops. It will work brilliantly.
Yeah.
These are customized, by the way. This is the only product
Yeah.
which I customize depending on your symptoms. Rest all are already made with a certain kind of combination.
Yeah, like I've heard of rescue and walnut and
Yes.
these are the common Bach flower remedies, right? I've
Yes.
heard of them and I've also consumed some of them
Yes.
some years back. But the happiness one was new for me as well.
Yes.
So you mix couple of them to give you this
Yes.
effect?
Yes.
Wow.
I customize depending on the symptoms.
So if somebody's coming to you with certain set of emotional trauma or
Yes.
unprocessed emotions, you will customize it. So no two people get the same happiness drops, you mean?
Correct. Absolutely
Wow. And
correct.
that's how personalized it is. So that's amazing.
Yes.
Lovely. And what about your chronic lifestyle conditions like diabetes, blood pressure? Because I remember you had given a few drops for my mom also, and you said, Neha, just ask her to try it.
Yes.
And my mom did tell me that, Neha, I feel like, my sugars are a little more balanced after taking Yatri's drops. So how do you work with these kind of patients?
So I'm glad. So let me name the 5 products which, I curated. One is the BP drops, the DM drops, those are the diabetes, the happiness drops, hair serum, and weight loss drops. I call that weight loss, but it's more for improving your metabolism.
Okay.
Okay. Now, again, if you realize once you get diabetes or BP,
Yeah.
there are fluctuations, there is no maintenance. And so these drops firstly help to maintain your blood sugar levels and even hypertension. So for BP also. Now, this is again under medical guidance. First, I would absolutely see their, properly monitor their blood sugar,
Yeah.
make them do blood tests. If they have hypertension, right way to diagnose, and then according to whatever the parameters are,
Yeah.
give them the dosage. So the more, my focus is to bring the balance
Yeah.
in the blood sugar and BP, and for the new ones who have recently been diagnosed, for them it works brilliantly. Again, without side effects.
Right.
So, and there are mixtures of certain homeopathy mother tinctures and herbs. So you can take with your conventional medicine, just take off the shelf product, and we have a way to follow up system, and so it works brilliantly.
So you personalize it for diabetes, blood pressure, and all other conditions as well. So it's not again the same medicine like in
Yes.
allopathy. We get the same medicine.
Correct.
In allopathy for every symptom. But
Correct.
You do it specifically. Okay.
Yes. So the BP and the diabetes drops are per se, they have a certain specific combination, but the dosage is customized.
Got it.
Um,
As per
where-
their sugar levels,
Yes.
as per their blood pressure.
Absolutely.
changes. Yeah.
Absolutely. Whereas happiness drops is completely customized
Okay.
because every person's mind and reaction to a same event is different.
Different, yeah. So you
Yeah.
have to learn about the person before you make it for them.
Absolutely.
Nice. Okay.
Absolutely.
And does this also work for, like, say, lower back pain or arthritis, or somebody who has stiff joints or muscles? Does your treatment work for them as well?
Yes. So for that, I would recommend homeopathy.
Okay.
Because inflammation in the body
Yeah.
needs to be treated with some medicine.
Yeah.
So, like homeopathy. So, homeopathy works very well. Now, homeopathy also, it depends on how long the patient is suffering from that kind of inflammation. That's the first thing. And how deep rooted, which joint has been affected. That's the second thing. And third, accordingly, then, the inflammation with the symptoms reduces. And in case if there is any psychosomatic disorder involved in it.
Yeah, so what I wanted to ask you is, say my dad has extreme lower back pain,
Huh.
chronic,
Huh.
since years, all right? Doesn't work out, doesn't want to work out, but okay, does a little walking. But if he works out, his muscles get sore. So that
Yeah.
is like, he gets demotivated and he kind of just stays away from it because I don't want to bear more pain. That's what
Yeah.
he says.
Yeah.
So for somebody like this, would you work only on the pain, or would you also ask him questions regarding his mind and emotions and everything to understand where the lower back pain is coming from?
Good question. I would consider both. So I would give the symptomatic relief, at the same time give his constitutional remedy.
Okay.
So constitutional is that individualized single remedy which affects the vital force.
Yeah.
Right? And with that, if the inflammation, like just like your dad's example, it seems like the inflammation must be more.
Yeah.
And so do a combination of both and give him. So that works better.
Yeah. The L4, L5 problem, the
Yeah. At the
deviated
same
discs.
time, yes,
Yeah.
I was going to say, whenever there is a mechanical problem in your body, mechanical problem in the sense when the back,
structural
structural
problem.
problem, that cannot be corrected just by medicine. Could
Yeah.
be any medicine.
Absolutely. You need to do physical therapy, you need to do physiotherapy, or,
Yes.
some sort of exercise to bring that
Right.
strength and the mobility back in that joint.
Yes. So if someone asks me, can you treat it 100%? I would say, well, we can deal with it and we can give you relief
Yeah.
because a mechanical problem is involved.
Exactly. So you'll also recommend them to do some physical therapy, right?
100%.
Absolutely. Yeah.
100%.
That's how it should be: honest, clear, and absolutely keeping the patients
Well educated,
well-being,
informed.
in mind. That's
Yes,
it. Yeah.
absolutely.
Otherwise, there are people who make all sort of claims, in the market. Take
Yeah.
this medicine, this will get okay. And of course, people fall for it. My dad also has fell for a couple of things, and I'm like, Dad, no medicine is going to help you.
Huh.
You have to do your exercise and stuff. So he does his physiotherapy. But there are people who definitely fall for such things. अच्छा ये लेंगे तो इससे ठीक हो जाएगा, मेरा सब कुछ ठीक हो जाएगा. But yeah, if there is some deviation or there's some structural issue, you
Yeah.
got to deal with that.
Yeah,
right?
absolutely. I would really urge people to be aware of such kind of treatment plans, and
Yeah.
false acquisition rather than
Absolutely.
very neutral and the expertise, with your experience. Advice, I think that's the best. Therefore, very consciously, I've put a tagline to my practice. It's called where cure and converges. Care and cure converges. So it's called Dr. Yatri, and my tagline is where care and cure converge.
Wow.
I truly believe in this.
Yeah. You have to care for your patient. The intention and the integrity has to be in place if you have to do good work and, help people. If that's what you're doing and that's what you're claiming to be, then, of course, I think care and cure both are very, very important. So that's a beautiful tagline.
Yeah, thank you.
And what about hormonal issues? Say girls who are now dealing with infertility, or women with menopause or perimenopause. Perimenopause is very intense now. I see a lot of clients with perimenopausal symptoms at 40, at even 38 and 39 now.
Yeah.
Right? Because there's early perimenopause also now.
Yeah.
I mean, when my mom had menopause, or maybe till 5 years back, we only heard about menopause. Now
Yeah.
there's perimenopause, and now there's also early perimenopause.
Yeah.
So I don't know how much are we going to go, towards the age that's more younger and get into these issues, I have no idea where we are headed towards, but Yeah, that's happening.
That's true.
So,
That's
how do
true.
you take care of the perimenopause, menopause, early menopause, and the
Yeah.
infertility and stuff?
Yeah, menopausal issues are not only related or connected to the endocrine system.
Yeah.
Actually, the whole body is involved in it. Yeah, right from physical, mental aspect, but also the neurological system, the endocrine system, the autoregulatory system, and the immunity. Everything is involved when we talk about hormonal imbalances
Right.
or menopausal issue. So firstly, we need to understand that deeply. Second, nowadays, because of, as you mentioned, why this early perimenopause and all that, that's because of our lifestyle changes.
Yeah.
Let's truly accept that's the realistic world. In our previous generation, like our moms and all, they had the joint family system, good food. We saw the lifestyle was great.
Yeah.
So in a way, they all helped each other, and probably they didn't, actually experience too much of perimenopausal issue.
Yeah.
Now coming into nuclear families, lifestyle issues, more and more awareness. Probably a lot of them are hypochondriacal symptoms. You just listen to it, and even if you don't have symptoms, you kind of bring your attention to it, and probably
Yeah.
you blow it out of proportion. So that's happening around. Now, coming to my treatment, I work holistically with my patients for hormonal imbalance. So if they come and tell me, Doc, I've got, say, irregular periods, hot flushes, irritability,
Yeah.
of course, homeopathy, the customized homeopathy medication. But along with that, I highly suggest happiness drops, which calms their emotional, and psychotherapy. Because if you do not know how to deal with your mind, your emotional
Yeah.
state, understand and learn brilliant tools and techniques through one-to-one psychotherapies, how will you be able to come out of your stress patterns that you have unknowingly created
Yeah.
for yourself?
So, what are the psychotherapy tips or guidance that you give people? Can you share some with us?
Sure. So the first is, at that stage, a vacuum has been created. So mostly at that stage, mostly your parents are old enough, so you are responsible.
Yeah.
Your children are ready to fly, get into good universities. If you are a homemaker, then suddenly you feel, okay, what other work do I have?
Yeah. What's my identity? It's identity crisis, no? At that point.
Absolutely. A vacuum created, and they feel, okay, I am trying to keep myself busy, yet I'm not happy. That's when you start noticing a lot of your symptoms.
Yeah.
Yeah. So I call it the ABCD technique. A is for attention. A is bring your attention to whatever symptoms you have.
Yeah.
B is break.
Okay.
Give a break to your mind that is flowing. Even if it could be for few seconds, few minutes. Give it a break.
How do you do that?
You do it again. It's called like a tapping system. That means you, like for example, there are 3 things which again work very well for that. So if you want to stop your flow of mind, firstly, A, attention, B, you say break. Now either you tap yourself and say, hey, you're going on negative side.
Oh, okay.
Hey, stop. Even if you don't stop, then you start pinching. So you are bringing the neurosynaptic, connection here. In spite of doing that, then you don't stop. Then what you do is try bringing your attention to the present moment. Mindfulness technique you bring. That's the third one. So your flow of thought is going on. So you say, hey, stop. And suppose it's negative or positive, it's still going. Then you say, hey, what do I see here in the present moment? What do I hear? What can I taste? What can I feel? So automatically you're bringing your shift to somewhere else. And when you keep on doing that, a
Right.
pattern is set.
Broken. And it's broken also.
It's absolutely broken. And to treat anything, the first step is awareness and attention, which you've already done. So 50% of your work is done. Fourth one, which also works, is the tapping system, which I call. So tap on the different sinus points, which will open up your lymphatic system.
Drainage, yeah.
Again, bring your attention to the present moment. And the fifth and most brilliant is the breath work.
Yeah.
Sudarshan Kriya is what I teach.
Yes, I was going to ask you that. So you're an art of living teacher.
Yes.
So do you incorporate the sky technique in your practice with your clients?
Totally.
Okay.
Breath work has a lot of benefits. And when we integrate everything together, finally, breath work is what makes maximum difference with your medication and other stuff as a physician you want to do. It helps to, remove the toxins. It helps to improve the vagus nerve connection. Immunity improves. So the breath work, and it could be any kind of breath work. I've experienced Sudarshan Kriya because I'm a teacher. I've experienced myself, so that's what I would like to teach. But any breath work in a certain pattern, which brings rhythm.
Like the 4-7-8 or the box breathing. Or just a simple Anulom Vilom.
Yes. Yes. You will surely 100% feel the difference. So these are a few of the tips that I give to women suffering from perimenopause. Okay, so apart from vacuum, there's a second thing, as you mentioned, identity crisis, but it's also, apart from that, a feeling of wholesome, which needs to be imbibed. And that comes by continuous automated reinforcement of statement, of positive, affirmative statements.
Okay.
I'm beautiful. I'm enough.
Yeah.
I'm wanted. I'm loved. Yeah. Those itself makes you feel so complete. Just wake up, open your eyes, tell yourself, I'm complete, I'm beautiful, I love myself, I'm enough.
Because I think we don't even realize sometimes our self-talk gets so negative and we keep repeating the negative statements about ourselves to ourselves all the time without realizing, and then that suddenly becomes our reality. We just look back and we were like, oh my God, I wasn't this some years back, and now suddenly I've become this. But it's because you've also constantly reaffirmed that to yourself all the time, that मैं तो ऐसी ही हूँ, मैं तो मोटी हूँ, मेरा तो कोई ध्यान नहीं रखता, मैं तो हूँ ही बेकार, like I'm not wanted in the house. When you have these situations where nobody's probably understanding you, especially during perimenopause, menopause, I think women also go through a lot of emotional pain because nobody's understanding them. Nobody understands what they're going through, and suddenly kids are like, Mom, what's wrong with you? You weren't like this. Husband is like, kya ho gaya? Why so many mood swings? I get husbands coming to me with wives saying that, Neha, I don't know what's wrong with her, but since some months or years she's behaving very funny. And I'm like, you need to understand her a little more, because she herself doesn't know what she's going through. She's trying to figure out, it's a new phase in her life. She's transitioning, and the transition is painful. So they need your support,
Absolutely.
You got to guide patients like this and their family members. But like you rightly said, I think just even playing affirmations in the background, like while you're working, cooking, let them just go on and let your subconscious hear them. Let it seep into your subconscious, and then you start rephrasing the statements, right? You're not then saying the wrong things because you're hearing the right things from outside.
Totally. And also, once they understand, and family members understand, that the person is doing unknowingly. Not consciously, subconsciously, because those hormones are the ones which are kicking and making you feel that way. The lady doesn't want to behave in a certain way.
Who wants to behave like
Who
this?
wants to behave? So, and once you empathize with that, you start bringing that family support as well.
I think that's more important. Family education for perimenopausal, menopausal women, I think that should be a separate course on its own. Please come and learn what your woman is going through, your mother, your sister, your wife, your partner, whoever in your life is the lady, what she's going through, I think.
And it's not only mostly mental symptoms, but also a lot of physical changes. She's not being able to lose weight. She gains weight spurt of a second. The body shape is changing. A lot of changes that she's not expected herself from.
It's new for her.
It's
like how
give
a
time.
Girl gets period for the first time. And for her it's so new. So the mother and the father and the family, the grandparents have to talk her into it, that okay, it's fine, it's a new phase, you've become you're becoming a woman now, and this is fine, and whatever, you educate, right? I think even perimenopausal and menopausal women need education, and their family needs education above everything. So, but that's so amazing. And do you also counsel girls who come with PCOS or missing periods, and help them to get the balance between the feminine and masculine, because so many women today are alpha women, and
Yeah.
we wear that coat and we forget to remove that coat even when we go home. So we are
Yes.
constantly in that masculine phase of hustle and go go go, do, and achieve, but
Yeah.
feminine is more slow and relaxed
Yeah.
and creative, but and we don't we're not tapping into that side of ours too much, because
Yeah.
life is busy, work is important, and all of that.
Yeah.
But how do you help these girls who come
You're
in?
very well put this, the feminine energy, trying to be alpha male. And by doing so, the hormonal imbalance, especially the testosterone, becomes a little higher,
Yeah.
leading to a lot of, PCOS, and electron comes in, and hormonal
Yeah.
imbalances. And that's what one needs to accept somewhere, that this is my energy, what are my strengths here,
Yeah.
what are my weaknesses, and what are my limitations.
Yeah.
What do I truly want to do? What do I truly want to accept, and what is my focus here? Is it just about achieving XYZ? Or the focus can also be myself,
Yeah.
being happy, being balanced, and yet achieve that XYZ. So that's my whole focus when I do and deal with such kind of women going through infertility and PCOS.
Yeah.
It doesn't matter if your prolactins are high. It doesn't matter if your ovaries has extra cysts. It doesn't matter that you are going through a lot of infertility issues and you're trying to focus. What truly matters, are you joyous? Are you happy?
Yeah.
What is your final focus, and why are we human beings here? To actually vibrate in the energy of compassion, of joy, or of
Yeah.
happiness.
Yeah.
And is that missing? Then
Yeah.
let's start bringing that balance inside you.
Yeah.
When you consider that and help them, handhold them towards that, slowly the disease also runs away.
Yeah. It's like tapping into your divine feminine. It's tapping
Truly.
into the bliss, and the peace.
Yeah.
I think that's most important, because happiness is still fleeting, but are you peaceful, irrespective of where your life is at right now?
Yeah. Yeah.
And if you're not, then what are you doing to make it better? But at the end, are you peaceful? Like, either it's a blessing or a blessing. So are you seeing it that way, or are you seeing yourself as a victim of life? I think that also makes a huge difference.
Yeah. Yeah. Of course, there are brilliant remedies in homeopathy to treat PCOS. I've treated chocolate cyst too. That kind of course, with, I'm always in connection with the
Yeah.
gynecologist or whosoever the specialist
Yeah.
is.
How about
And
fibroids?
Fibroids, it depends on the size.
Yeah.
So I always say, though a lot of people claim we treat fibroids, but depends on the size, depending on the symptoms. Say if you have amenorrhea for more than 6-8 months, you've tried everything, and the fibroid size is increasing, I would say, hello, it's time to do surgery, it's time to do something about yourself. So the experience and diagnosis are of utmost importance for a physician. So yeah, fibroids can be treatable, but always see the size.
And then,
Multiple sonographies. I'm always in touch with the physician. I always, I love working in integration with my physicians.
Yeah.
And luckily, we all have like a lovely team around of doctors whom I work. Very, very well-known doctors refer patients to me directly, and I would do the same to them.
Yeah. And that's how it works, hand in hand.
Yes, yes. Just like something like menopausal, when we were talking,
Yeah.
the importance of the supplements.
Yeah.
Yeah. And you are so good with it, and the importance of the diet. I would happily refer my patients work in integration, because I know just somewhere homeopathy cannot 100% help. Somewhere just psychotherapy cannot 100. They need to take right supplements maybe. And if you are a specialist in it, why not?
Yeah. And also get the
integrate system.
foundational wellness in place, because
Yes.
that's important. Like, I mean, I can give you the best food, the best remedy in homeopathy, and the best supplement, but if you're not sleeping well, and if you're not managing your stress well, then none of it is going to work for you. So where is your foundation wellness? Is that in place, and is that under check, or is that all over the place, scattered? Then boss, nothing's going to work for you. Get that right, and then work on building up your health from there.
Yes.
I think that's important.
That's so important. That's so important. I also want to bring into awareness and notice of people a lot of information is out there on the social media.
Yeah.
Yeah, and sometimes it's the right information. Sometimes it's without a doctor's, or a physician or an expert information. One should not go for it because its repercussions are so bad. Like I had this patient, this thing about hair fall. So I treat hair fall.
When you said you have personalized formulations for things, you also mentioned about your hair fall serum. And I remember you telling me earlier on that it's one of the best for hair fall and it arrests hair fall and nourishes the follicles and the hair scalp and stuff. Can you tell us more about that? Because I think hair fall is a concern that is universal. Because of the water, because of the stress, pollution, we all face hair fall sometime or the other. And most people are literally struggling with hair fall and have no solutions for that because they're not working on their gut, they're not working on their overall health.
Yeah.
So how does your hair serum work?
So my hair serum actually, it works brilliantly. It is supposed to be put externally. It helps to actually make the hair roots stronger.
Okay.
Also for people having dandruff, it helps to remove the dandruff. And with that, it curbs the hair fall. So slowly it reduces. Now, apart from using that, if the hair fall is chronic or if someone has more than 30 to 40 hair strands a day, then that means internally there is some problem.
Right.
And how much ever we say hair fall is an external issue, I would say it's more an internal issue.
Totally.
Yeah.
Totally.
So that's the parameter I tell my patients to know the difference between using just the hair serum and doing a combination of homeopathy, sometimes psychotherapy, and my hair serum.
Okay.
Now, hair fall is related to 4-5 major things. One is stress, of course. Due to stress, there is something called as telogen effluvium stage, and the hair just stops growing.
Yeah.
The second is, of course, the hair fall is related to something called as autoimmune disorder, which is alopecia.
Yeah.
Now, that only needs to be treated again with something as powerful as homeopathy for autoimmune to bring that regrowth phase.
Yeah.
And the third, as you mentioned, the different parameters could be hard water, could be vitamin D3 supplements that's required.
B12 deficiency, iron deficiency.
Iron deficiency, yes.
Yeah.
So nutritional deficiency, also the wrong kind of diet. So that's the third
lack of protein.
Major causative factor.
Yeah.
But there's a fourth one also, using wrong products.
Oh, totally. I think that tops the charts.
Yeah.
We all have been using.
Yeah.
Now that there is awareness, I've also shifted, but most of the people are watching ads and social media and the kind of things that are being promoted on social media today.
Yes.
People are just picking up stuff and ruining their health internally and externally. So there's supplement recommendation, there's homeopathy recommendation on social media. There's so much going on there and people are just using whatever and damaging their hair.
Yeah.
So much chemicals.
Yeah.
So, yeah.
So due to this over data flow from social media, there is a terrible problem happening there because just people without understanding, without taking doctor's recommendation and an expert recommendation, off the shelf, listening to social media stories, they are self-medicating. And it is so dangerous, Neha, I can't tell you.
Yeah.
Even things like not taking supplements at a certain dose with a certain way because every problem is individualized.
Yeah.
Not all problem is same. And buying anything off the shelf, even like supplements, it's a total no-no.
Yeah.
And just making a small difference of combining two supplements can give you much more better results.
Yeah.
So why not go to an expert or a doctor?
Yeah.
Even things like home remedies, like especially some onion juice on your scalp, it has ruined people's scalp. And then they come running to us, doctor, my hair is falling, like even if I touch my hair, 15 strands come in my hand.
Oh my God.
So this lady connected to me, she resides in Canada, and she's like, doctor, every year I come twice to India to Chandigarh. I try ample of things, right from straightening, everything, but nothing works. Now I've reached a stage where I just touch my hair, pull slightly, and 15 strands comes off.
How traumatic that could be, right?
Can you help me? So when I went into detail, case history, one, of course, she had just delivered baby, 6 months old. Number two, she was using from last 6 months direct onion juice on a scalp. Now understand, when you put onion juice, it is so pungent.
Yeah.
It has certain acids. It's acidic for your scalp. Scalps become extremely sensitive and using on everyday basis for 6 months.
Yeah.
her scalp became literally red and inflamed,
Yeah.
causing so much hair fall.
Yeah, like I've heard of onion oils, which are better because you're boiling onion. It's
Yes.
getting into the oil.
Correct.
And oil is so soothing
Yes.
for your, skin, like
Yeah.
coconut oil or castor oil or whatever
Yes.
oil that you choose.
Yes.
So then you get the benefits of the onion through the oil.
Yeah.
But just putting onion juice on the scalp is...
Directly using
Yeah,
onion
sounds
oil,
like a destructive
totally
remedy.
destructive. Even if you want to use in hair oil, the kalonji seeds or the onion seeds is what needs to be done. And there is a procedure for every single thing.
Yeah.
Every single, even using too much of oil is not good.
Right.
And depending from case to case, your scalp is different, your hair consistency, the density, the problem, you as an internal person, everything is different. Then how can you use the same remedy and same information right from social media for yourself? You're harming yourself rather than doing good.
Yeah.
So just a big word of caution with 2 red underlined things. Please do not self-medicate. Do not take supplements the way you want. There are even homeopaths, a lot of homeopaths off the shelf, random for diseases, they give names.
Yeah.
But homeopathy is so deep-rooted, and the main principle lies on individualized system. Only after a detailed case history and consultation, connecting the dots of mind and body,
Yeah.
one needs to give the remedy, and then you see the real difference and long-lasting difference with homeopathy.
Yeah.
So it's a big word of caution out there.
No.
So coming back to the hair fall treatment and the hair serum that I've curated, again, it's a part of my journey, and there's a beautiful story. If you have quick 5 minutes, I'll quickly tell you.
Please share.
So this was again COVID times, that stressful time. One of my friends, she owns 3 salons in Mumbai, and she happened to call me, "Hey Yatri, do you have anything in homeopathy for hair fall?" I said, "Yeah, sure, let me take your case history." So I took her case history, and after that, unknowingly, I curated this hair serum. And I don't know why I did it. I mean, I used to do it, but that combination I never.
Right.
I made a combination, gave it to her, homeopathy and this serum, and I said, "Listen, use it externally and take this medicine." For 2 months, I didn't hear from her. Now, as an expert and a physician, that if a patient doesn't come to you, either the patient is extremely good or is not good.
Yeah, either they've moved on or they're just happy with whatever you gave them.
Right? Yeah. So after 2 months, she connects back. I'm like, "Hey, what's happening?" She's like, "Open your WhatsApp and see the pictures." I couldn't believe her before-after pictures of hair fall. She's like, "Can you do me a favor? That liquid that you gave me to put on the scalp, can you give me 6 bottles? I said, "Why?" And then she sent me, I saw the pictures. She's like, "You know what? I've been using it regularly. It's awesome." Now, she has a salon, right? And I snapped back to her. I said, "Listen, I don't do business. I cannot give you some products like this.
Just like this,
And I can't do it." Now, after that, next 6 months, I start getting a lot of patients of hormonal imbalance, unknowingly hair fall, and I do the same combination. After 6 months, I go to a salon. It was December month. And, I go to a salon. I said, and she's doing my hair. And suddenly she stops doing my hair and she's like, "You know what? She's also a tarot card reader. I get this direct message from Jesus that you have something so beautiful and you're refraining yourself from using it, your hair serum." And I look into her eyes. I'm like, "What are you saying?" So Neha, after that's 2021. Next 2 months, Jan and Feb, I really start thinking about it. I said, if I want to really come up with my line of products, it has to be my style.
Yeah.
So I came up with the packaging, the bottling, the labeling, everything.
Yeah.
So unknowingly, for 6 months, I've already done, the trial is done. I see the beautiful results in 6 months of my patients. And I see this product coming.
Wow.
And once I just launched it, February 2021, there was no looking back. Off the shelf with such brilliant cases back. So that's been a little story to it. And now I have combined it totally with like a package which includes the psychotherapy, homeopathy, and my hair serum. The holistic thing.
That's awesome, What needs to be out there, universe will find a way through you to get it out there.
Yeah.
And that's how it is.
And I still meet her. I'm like, "I'm so thankful you are a partner in this. Come on."
That's so nice.
Yeah.
That's lovely,
So that's a little story, but this is what happens with hair fall. And I'm telling you again, you must have also experienced after COVID, a lot of hair fall cases have
The
increased.
COVID vaccinations, the stress, trading sleep,
Illness, chronic illness.
and trading sleep with Netflix. So
Yes.
a lot of that, I
Yeah.
mean, it's again boiling down to the foundational things which are not in place. So
True.
hair fall is the first sign.
Yes.
The body doesn't prioritize the hair. Doesn't You can survive without your hair, right?
Yes.
So the body doesn't need to constantly nourish the hair if other organs are not nourished.
True.
It will prioritize other things and survival over beauty.
Totally.
So, yeah. But thank you so much for sharing this. So, now moving on to the myth and fact section. I'm
Okay.
going to give you a couple of statements. You have to say whether it's a myth or a fact. And if it's a myth, then you give me the fact for it.
Okay.
All right. So, homeopathy is just sugar pills with no actual medicine.
Big myth. The outside sugar pills look the same. It's made out of sacrum lactose. But the medicine, the drops that we put are different for sure.
Okay. Thanks for clarifying that, because this is one myth that we've been hearing all through through all these years,
Yeah.
that homeopathy is just sugar, it's nothing else.
In fact, homeopathy can be taken in different ways, not just through sugar balls.
Yeah.
Even in the powdered form, liquid can be given, which can be mixed in water and had.
Yeah.
So depending from case to case.
Okay. Homeopathy is slow and only works for minor issues like cold and cough.
A big myth. So it all depends on how long the patient is
Yeah.
suffering from and the intensity of the disease.
Okay.
So if I get a patient who has got diarrhea since 2 days, within 2 days homeopathy works brilliantly. So it works as fast
Okay.
as any allopathy medication. It's that fast.
Nice.
So, but what happens is over the years, only chronic patients have come to homeopaths. So, suppose if you have arthritis from 10 years, how can you expect to be treated in 2 days?
Yeah, because when they get an allopathy prescription,
Yes.
the pain is gone in 3 hours because that's a painkiller.
Yes.
So they expect the homeopathy medicines also to work as fast as that. But then that's not curing and this is curing.
True, true. That's the whole difference.
Yeah.
It causes suppression. It can give a quick fix, but homeopathy has no suppression,
Yeah.
no side effects, and long lasting effects.
Great. Homeopathy and allopathy cannot be taken together.
Again, a myth. It can be, again, from disease to disease. Usually, if I give a combination of two, I ask the patient to keep a gap of half an hour to 1 hour between the two.
Okay.
And so the absorption of both can be, and its effect can be seen.
Okay. Homeopathy has no side effects because it's just placebo. Yeah.
Yeah, again, a big myth. Sometimes it could have a placebo effect in patient's mind, and there's been a whole research done. If you just Google and check, you will know the effects. But homeopathy is extremely powerful. Just by giving a placebo effect, you cannot eradicate a disease.
Yeah, that's true.
And we have seen such brilliant cases where right from your laboratory diagnosis to the disease going out, everything works so brilliantly. Definitely homeopathy is working out there.
Okay, nice. Homeopathy medicines are same for everyone, which
A total myth.
yeah,
a
which
total
I think you
myth.
clarified
Yes.
how customized it is.
Yes. In
Okay.
fact, there are so many remedies. Just for fever, there could be 20 remedies.
Oh.
So we have like a whole repertory, check the symptom and stuff like that. With modernization, of course, everything has come on a software, laptop, it's a little faster.
Yeah.
But it's that deep-rooted medicine.
Wow. Okay. You have to stop coffee, onions, garlic to take homeopathy.
Kind of true, because it contraindicates the medicine effect.
Okay.
Especially coffee and raw onions. So these are the two major ones.
Okay. Okay. And homeopathy only works if you believe in it. We've heard of that.
Yeah.
All
so
this while.
if you believe in allopathy, only then it will work on you. True.
Yeah.
If you believe in your physician who gives allopathy,
Yeah.
it will work on you. So anything that you truly believe, be it allopathy, Unani, homeopathy, breath work, nutritionist, whatever, once you believe, it will work for sure.
That's
but
true.
Apart from that, the scientific research and the symptomatic relief is what one needs to bring attention to.
Yeah. So it will also work if you don't have 100% belief in it. It will still have its effects, right?
Yes. Yes.
Like how painkiller, you take a painkiller, whether you believe it or not, it will have its effects. It will make your pain,
Yeah.
sort of better.
No, so the paracetamol has a lot of brand names. If you go to a certain GP and you don't believe in that GP, even that paracetamol will not work on you.
I agree. Belief is the first and the most important step towards healing. You got to
Yes.
believe in what you're doing.
Believe
Trust the
and
process.
trust. Yes.
Yeah.
Yes.
Yeah. Homeopathy is not effective for serious diseases like diabetes, infertility, or depression.
A total myth. A total
Yeah, you clarified that for us. And homeopathy is outdated and unscientific.
I think we began with the scientific knowledge
Yeah.
and research and the depth of homeopathy.
Yeah.
In fact, it's the only science, I should not say only because Ayurveda is also the same, which when it was researched and when it was curated, the same drugs we use it now after 200 years as well.
Yeah, and how about being outdated?
Well, patients who have taken homeopathy, they know the answer. It's
Yes,
not at
that's
all
true.
outdated. Yeah.
And now we come to our last section, which
Okay.
is the rapid fire.
Okay, I'm excited.
Yes,
Is it like
let's keep it fun and rapid.
okay?
So tell me,
Let's go.
Yatri, are you an early bird or a night owl?
Early bird for sure.
Okay. What's your comfort food on a not so good day?
Soup?
Soup?
Salad? Yeah.
Soup salad?
Serious.
Wow, is that your comfort food?
I'm telling you.
Wow. One book that changed your life?
Autobiography of
A yogi.
A yogi.
Yes.
by Yogananji. Changed my life. Brilliant.
Yeah, it's
Brilliant.
amazing, that book.
Brilliant.
I've read half of it. I still have to complete it.
It has changed my life.
Favorite hobby outside of medicine?
I love traveling, as my name adds to, and exploring.
Okay. A song that instantly lifts your mood?
Dil hai chota sa. Choti si aasha.
Nice. If you weren't a homeopathy doctor, what would you be?
Truly, I don't know. I always wanted to be a doctor.
Yeah.
It is quite, I can't believe it, but even as a child, always wanted to be a doctor. But if not a doctor, I'm already on the path. I'm also a spiritual teacher.
Wow, yeah, probably, yeah.
So I've finally reached there, but I don't know. I have not thought about it.
Nice.
Or
okay.
maybe a businesswoman, because my husband keeps on saying you have that business angle to it, and I'm not sure. I said no. I don't know.
Yeah, but yeah. I mean, a lot of possibilities. So, are you more of a planner or spontaneous?
Spontaneous.
Yeah.
But also a planner. I think I'm a balance of
right?
both.
Yeah.
I'm a balance.
Depends
of
where
both.
you need to be what.
Yeah, but I could be impulsive. There could be like immediate response, not even a second. And there are times where I plan beautifully. Like so,
Okay.
I would be a combination of two.
Good. One thing you always carry in your bag.
My phone.
Whether you have a bag or no, we all have our phones on us.
Yeah.
So, hey, a quote you live by.
Live life fully. Explore every element of your life.
Nice. If you could go back in time, what advice would you give your younger self?
Be patient. Everything will come at its own time.
Beautiful. Beautiful, Yatri. And with that, we come to an end of this amazing episode.
I loved it.
Thank you so much for sharing such deep insights about homeopathy, because really the world needs to know about it, and most people still believe in those myths which are outdated and not homeopathy which is outdated. So,
Yeah.
which is not outdated. So, I think that's important and we had to bring it out. So, you brought it out beautifully, and thank you for sharing your light.
Thank you so much, Neha, for bringing this together, because we could feel the synergy today, and it's that amalgamation together, being spontaneous as we are, and just going with the flow has brought this podcast together. So thanks again.
Thank you once again. Thank you so much for watching this episode right till the end. I have taken back a lot of insights from Dr. Yatri about how homeopathy can help in holistic healing, not only for lifestyle disorders but also for acute conditions, and to help you improve your mood and emotions as well. And I'm sure you have also learned a lot from her. So don't forget to like and share this episode with all your friends and family who will benefit from this episode. And if you've liked what we've shared, Please hit the subscribe button because you will be notified for all other insightful episodes that we come up with. Let us know your views in the comments below and stay tuned for our next informative episode that we are going to come up with on That Healing Feeling.